Hi, I'm Dr. Rodger McCoy. I'm a sports medicine physician here at Banner University. I see all sports injuries and musculoskeletal injuries along with concussions. As a physician, I've always loved working with people and helping people, so I've used my science background and training to fulfill that. And I was able to follow high school sports, team physician for Arizona State, and my 28th year as one of the head team physicians for the Arizona Diamondbacks, along with taking care of both the recreational athlete and Olympic athletes along the way. We have a whole team that we work with. We were never by ourselves, and that includes our athletic trainers who are first providers for the athlete at the school that they're at or at the team that they're at. And we have discussions with the coaching staff, especially with student athletes, the parents, and explaining what the injury is and how we're going to help them recover. You know, they say if you enjoy what you're doing, you never work a day in your life. And when you're helping people, it's very special. And for me to be able to tie in my love of sports is just amazing. And Banner has allowed me to do that to its fullest. People ask, what did it take to get there? And obviously you have to love to learn. And part of that learning is in the science, the writing, and the reading, because those never end if you become a physician. We're constantly learning, we're constantly changing and adapting to the newer sciences and things that do present themselves with further research. I'm asked many times what skills that I needed to progress on towards medical school. And the first one obviously is science. And with science, you're learning the human anatomy, the human body, how it functions, and all that is so important to becoming a physician. Next is reading. You have to love to read because we're constantly learning all the time with updated data that's coming from research. You know, besides understanding the science of medicine, the thing that I use the most is my ability to listen to the patient and my attention to details. So when people describe injuries, you may be thinking of one thing, but after you listen to enough of the details, you might take you to a different diagnosis. My advice on what to tell a young student and how to progress through this would be, first of all, paying attention to your course studies, making sure you like science and are getting those grades that you need. Staying active outside of the classroom as well helps mold you into what we consider to be a good physician, followed by volunteering times, either in high school or even in college, where you can volunteer at a hospital or follow a physician around to really get a feel for what you would like to do.